my name is Adam Sorenson. I'm a nurse educator at Denver Health Hospital. My role is nurse educator for our biocontainment unit. We are one of the 13 regional treatment centers, and the area we serve is Region 8, which includes North and South Dakota, Wyoming, Montana, Utah, and Colorado. My experience is pediatric intensive care, and surgical trauma ICU. And currently, as I mentioned before, I am a nurse educator for our biocontainment unit. So objectives today is to increase knowledge related to putting on and taking off personal protective equipment, or PPE. And this is also referred to as downing and doffing. And second objective is to identify where there are more resources for you to find related to downing and doffing. So key concepts that we're going to cover in this presentation is the 3 I's, or identify, isolate, inform. Does your PPE match the clinical picture? And then utilizing the 3 I's. Concept of trained observer, and that is a partner that ensures appropriate PPE is being used and safe practice for downing and doffing. The development or use of standard operating procedures and steps to follow to ensure that correct order are used to minimize any exposure risk. And then practice, whether that's quick on the job type of practice, or if you're able to do it in a drill setting, to practice your downing and doffing and SOPs. And what this does is get the user more familiar with the processes, also comfortable and safer overall. So these are some familiar pictures of personal protective equipment that you may be using for an activation of an infectious disease or chemical biological exposures. We have gloves, shoe covers, gowns, your respiratory protection, which could be a surgical mask N95. It could be a capper, PAPR, or elastometric respirator. Head and neck covers. I love this picture. It's the extended cuff gloves, which are great to cover your gowns, especially if your gowns have cotton around the wristband area. That is not technically a part of your PPE, so you want to make sure that's covered. And then eye protection, and face shield is ideal because this prevents the exposure or contamination onto your respiratory. So the 3 I's are identify, isolate, inform. First thing is, if you can get a health history, travel history, exposure history, that's going to help you identify suspected contaminants or disease. And also when you're identifying a possibility of having something like an infectious disease or exposure, you're going to identify the type of PPE that you're going to be using when in contact with that patient. From there, you're going to isolate the patient, and there's a couple different ways you can do that. You can take the patient and put them in a single patient room, put them in an area with low to no traffic, or put on PPE is always the most commonly used form of isolation. And then you're going to inform the proper authorities, whether that's your chain of command, your public health, the CDC, or federal entities, also your doctors, your nurses, things of that nature. And then go along the process of information gathering and taking the information from these entities and applying your standard operating procedures if you have them. This is a great resource from NETech, and what it does is it breaks down a bunch of different viral hemorrhagic fevers and the type of PPE needed. If you take a look at the second to last column on the right, the PPE, you'll see there is a common thread throughout them, and that's going to be your gown or coveralls, eye protection, respiratory, and gloves. And then there might be an inclusion of shoe, boot covers, and then coming down to ones that are person-to-person transmitted, you're going to be using your gloves as your standard practice. And then this is also a CDC guidance of PPE selection. Just identifying the type of PPE you have, how you're going to put it on. If you don't have coveralls, that's fine. It's selecting a gown that will meet the needs for the pathogen or for the type of exposure that the healthcare personnel might encounter. And this is a great resource as well from NEATEC that tells you all the different types of possible precautions that would indicate the type of PPE needed. So standard operating procedures are a great way to identify the step-by-step process of both putting on and taking off your PPE, and then practicing the standard operating procedures. Even if you have limited time, it's always a good idea to go ahead and put on the PPE, fit test it, make sure it's the right size, make sure it's the right fit, the right style, and then from there, ensuring that there are no gaps or deficiencies in your PPE, and then continue to evaluate the process and make changes as needed. And then having a step-by-step guide printed out, written out, laminated for the person in the PPE to follow, both putting on and more importantly, taking off, because once they're taking off their PPE, that's the biggest risk that they're going to have for contamination. And that allows them to follow step-by-step process, ensuring a higher level of safety and decreased risk of contamination. So practice in the PPE helps with comfort and understanding of your limitations while in the PPE. It also can impact the type of sensories you have in your PPE. For example, for a viral hemorrhagic fever, some places are wearing 2 to 3 layers of gloves, which can decrease your tactility, your sensory in your hands. And practicing with multiple layers of gloves helps you get more comfortable with performing your day-to-day tasks. It also improves muscle memory. So the standard operating procedure, if you're able to quickly put on and take off the PPE before you take care of a patient, because time sensitive, even practicing that just before you go in the patient room will help somebody understand the process and allows them to have the muscle memory. And again, familiarity in the PPE they're wearing. A couple of resources that you can go to for your downing and doffing processes in PPE are the CDC and NEATEC. And what they're going to do is you could put in, say, Ebola or Ebola and PPE. And what will pop up is they have some videos as well as an outline of the process for both putting on the PPE and, again, more importantly, taking off the PPE, a step-by-step guide. NEATEC also provides a step-by-step guide of what type of PPE is needed for the infectious disease that you're about to go in to patient care area or that patient is suspected of having. A couple big points for PPE, donning and doffing, is you always want to make sure that your mucous membranes are not exposed for as long as possible. So the thought is to keep your respirator, face cover, eye, mouth, nose cover on until the last piece of PPE is being taken off, or that is the last piece of PPE being taken off. Thank you for listening to this